Welcome to Face Values, the podcast where we peel back the layers of cosmetic surgery and skincare to help you understand how your skin is aging and what you can do about it. I'm Dr. David Jack. I'm a cosmetic doctor and skincare brand founder. I'm based in London. I've got clinics in London and Edinburgh. I've got a real interest in just understanding more about how the skin ages. So I'm going to be joined by lots of guests who are real experts in the field. So I hope you enjoy and keep tuning in. This episode, I'm joined by Dr. Chris D'Souza, who is a master in the field of hair transplant surgery. Chris and I worked together in the NHS before we both jumped ship. I went into skincare, he went into hair transplant surgery, and he's since become one of the most prominent hair transplant surgeons in the UK. He is the president of the British Association of Hair Transplant Surgeons. He's also on the board of the American Board of Hair Restoration Surgery, and he has treated thousands of patients. So thank you for being on the show, Chris.
No, pleasure. Lovely to be here.
So, Chris, kicking off, tell us about hair loss. What are the most common types of hair loss that you would see, and the things that most people are causing most people to experience hair loss?
Yeah, I mean, the majority of our patients are men.
Sure.
I'd say 90% of our patients are men, and they present with male pattern hair loss, which is androgenetic alopecia, so genetic hair loss. Most common cause is it's inherited. So often they'll present and talk about, perhaps a family history of hair loss, similar pattern in their father or brothers. And similarly, we do see female patients who similarly present with female pattern hair loss, and then you have the other conditions which may be secondary to underlying pathology, and that requires a bit more investigation and diagnosis.
Yeah. So what sort of things, aside from this androgenetic hair loss, what sort of things would you see rarely, but in your clinic? Is there anything in particular?
So for men, you might see, lichen planopilaris. You've got other, underlying pathologies. For female patients, they can often present with traction alopecia. So that might be from tight hair styling over many years. And there's various other pathologies which can present. But most commonly, I'd say it's, genetic and quite amenable to hair transplant surgery.
Yeah. And how about COVID? I noticed that I had a bit of hair loss during COVID. Is that something that you've seen in clinic at all, or? So
perhaps there was. I mean, COVID, similar to any sort of illness, can put a stress on the body. That can present itself in loss of hair, but usually after the stress of a sort of past 3 to 4 months later, the hair should come back. So for cases like that, definitely wouldn't jump in with hair transplant surgery, because in most cases, hopefully the hair should regrow.
Yeah. Okay, interesting. So moving on to hair transplant surgery, I'll admit that Chris is actually my own hair transplant surgeon. I had a hair transplant about 6 months ago with Chris. Really delighted with it. I think that I noticed my hair thinning over the course of a couple of years. It was definitely affected by COVID. I noticed quite a lot of hair falling out then, and it just never actually seemed to grow back. Because I knew Chris, because I've seen your results, I knew that you were the person that I wanted to go to. But what would you say the typical person coming to see you is like? What issues how would they present to you?
Yeah, I mean, the typical patient might be, perhaps, early 30s, 40s. As you say, often it's something which they've been aware of for a while. Male pattern hair loss usually presents a sort of slow, progressive loss, often in the temples, often a little bit of thinning in the crown. And we often find that there's a tipping point where, it starts from being able to cover things up and, things aren't too bad to perhaps losing a bit more hair and then thinking, it's actually bothering me quite a bit and it's perhaps time to do something about it.
Yeah. And do you see many people who are completely bald?
So we do see patients up to, we operated not long ago on someone in their early 70s,
okay,
who had quite a bit of hair loss.
Yeah.
So we do operate on people who are on the younger side of things, who have early male pattern hair loss, perhaps, sort of mid-20s. up to sort of 60s, 70s. But yes, in patients where they have extensive hair loss, the main thing to remember is that there's only so much donor to give, and therefore only so much coverage that they can achieve.
I see. So in terms of the different types of treatments that you do, you do a few different techniques of hair transplant surgery, I believe. So can you talk us through those?
Really, with hair restoration in general, I suppose you've got surgical side, non-surgical. Non-surgical is really important. So for the majority of our patients, I really stress the importance of finasteride, minoxidil, trying to stabilize any further hair loss, and that really ensures the best sort of long-term aesthetic result. And then when it comes to surgical options, really there's FUE, so that's follicular unit excision, which is where you take the grafts out individually one by one. And then you've got strip FUT, follicular unit transplantation, and that's, I suppose, the original technique where you're taking a thin strip of skin from the back of the head and you end up with a linear scar. So I'd say our practice at the moment is probably around 90% FUE, and that seems to be around the world. But not to say that strip FUT hasn't got its place. It's just better in certain cases than others.
And the process of FUE is the one that I had. It was very straightforward from my point of view. It was actually quite a pleasant day that I spent in your operating chair. What do you want to just talk through, like what the process is actually from someone coming into the clinic to what are the steps that you would do for that procedure?
Yeah, so obviously I see everyone at consultation to begin with. We draw out the hairline, outline the surgical plan, and that would include the type of surgery, so FUE or FUT, and then a rough indication of how many grafts required, and that depends on the amount of area to be covered. And then on the morning of surgery, most patients arrive around 8:30 or so. FUE, for the vast majority of cases, necessitates the shaving of the hair, which I'm sure you remember. So you have to take the back and sides right down to skin. The top is negotiable, but definitely better if we take it a little bit shorter. And then really it's a case of local anaesthetic, and then 3 stages of doing the incisions. That's where the grafts are going to be placed, taking the grafts out. So that's essentially from the donor area. And then in the afternoon, placing the grafts. So for the majority of cases, we might finish at perhaps 4:30, something like that.
Yeah. And how do you actually plan the hairline? Would that be based on what your general aesthetic is, or is there a more kind of, I don't know, objective or scientific way of doing that?
Yeah, so there's a few sort of hard and fast rules that you can look at. But more importantly, I think, is age of the patient, where you think the hair loss is going to go later on in life, and then trying to use your sort of aesthetic judgment on what's most fitting. The worst thing is when people end up with hairlines which are too low or too flat, because it can just look really unnatural, and especially as you get older.
Yeah, there's some parameters that you wouldn't go beyond, basically.
We rarely do very small surgeries, and that's really just sort of weighing up the pros and cons, because the biggest thing with hair restoration surgery is that hair which you're placing is from the permanent zone, so that will always be there. And what you don't want to be is in a situation where your existing hair perhaps progresses back. And you're left with a very low, sort of stark hairline, which is sort of not connected to the rest of your
rest of your hair.
So,
and how do you create the kind of, I know what you've done on me, the front of the hairline looks very kind of natural. It doesn't look like there's that kind of Barbie doll appearance of the hairs coming out, sticking out row by row. That's very obvious in some cases. What sort of technique do you do specifically that avoids that kind of look?
So hairline design firstly has to be appropriate to the face shape and age, as we were saying, and then after that you have sort of macro irregularity and then micro irregularity. So everyone's hairline is incredibly irregular, and obviously that everyone is slightly asymmetrical. Nothing is absolutely perfect, and that's what makes it look nice and natural. So it's that irregularity really, and then the use of 1, 2, and 3 haired follicles effectively. So from the back of your head, follicular units come out in sort of little bundles, and ones are fantastic for the hairline because you can make it nice and soft and natural.
Sure.
Twos and threes are great for density, but yeah, what you don't want is, as you said, sort of rows of big clumpy grafts at the front because it can look very doll's hair.
I see.
Like.
I see. Yeah. So it all really comes down to your experience. So this is the kind of artistic part of it, then.
Exactly right. Yeah. And then the angulation, of course, should be in the correct angle. So exactly right. You don't want the sort of perpendicular sticking from the scalp. So nice and feathered and natural.
I see. Interesting. And would you say that is there any difference that you would do for, say, a male versus a female hairline? Like, is there any differences in the orientation or the patterns of hair?
Yeah, I mean, female hairlines are very different to male hairlines. So the normal sort of, I guess, male hairline always has that sort of sweep into the temples. Ethnic hairlines can be different, but female hairlines are very much more rounded, a lot more irregularity, and that is something that we do. And also, we do see transgender patients as well, which is of course, the recreation, of perhaps a completely different hairline to what was once there. And
so, aside from surgical interventions, you touched on using finasteride and minoxidil. Are there any other kind of new treatments, would you say, coming out in the hair restoration space that you think have some promise?
I mean, yeah, you've got the most amount of evidence is oral finasteride,
right?
And then that's been formulated as a topical version. So I still recommend oral finasteride as number one, but a topical preparation is often more appealing to a lot of patients. And then you've got minoxidil. In the last few years, oral minoxidil has become more widespread. It's not licensed for use, but seems pretty effective, and long-term adherence is much better than topical application. So that's another treatment. And then you've got the sort of low-level laser therapy, PRP. You know a lot more about that than I do. But these are all good treatments and all to be used in the right circumstances.
And aside from that, things I think we've talked about it before. Robotic hair transplantation, these sorts of things. Is there any advantage to that, or do you think because it's quite an artistic technique, are you better just getting it done by a human?
Yeah, I mean, robotic hair transplantation, that was in the UK maybe even 10 years ago, and unfortunately I was, one of the few surgeons that was able to use it, and whilst it certainly has its place, to be honest, I think it doesn't compare to a hair transplant surgeon who's regularly operating and has an experienced sort of hand, so to say.
Sure.
The idea behind it is, is it more accurate? Is it quicker? Does it take out sort of the human sort of error and fatigue? But realistically, I don't think there's anything that can replace a surgeon.
Yeah. Is there anything AI in the world of hair transplantation that you've heard of or know of?
I mean, there is a sort of technology where you can show patients, what it might be.
I see.
So sort of hairline design, and this many grafts might give this
sort
of look.
Okay.
I've shied away from it, to be honest, because I think it may lead to sort of unrealistic expectations.
Absolutely.
But other than that, no. I mean, the technology's definitely got better over the last 10 years. So the quality of FUE grafts now is comparable to FUT, and that was the main reason why there were some advocates, and there still are, were saying, is the quality of strip surgery grafts still superior?
Yeah.
I wouldn't say that's the case anymore.
Sure. Yeah. And finally, you often hear about people, obviously, surgical tourism, going to Turkey, getting cheap hair transplants. Some will be absolutely fine, but have you seen any kind of disastrous cases, anything that really kind of can go wrong in that circumstance? Anything that stands out to you in particular?
Yeah, I mean, we do repair work.
Okay.
Not as much as I would have thought, and of course you always hear stories of someone who knew someone had a fantastic hair transplant in Turkey, for example, and it was much cheaper. But it does seem quite variable. So the most important thing is to make sure that the surgeon is doing the surgical steps, and
Yeah.
that is incision making in the recipient area, but also the FUE harvesting or the extracting. As I understand it, it can be variable
Yeah.
on the result you get, but often one of the biggest things is that you don't meet the surgeon until the day of surgery, and that can lead to terrible problems through no fault of the patient really, because you may well take in a photo of when you were sort of 20 and someone agrees to do a very low hairline, and you don't think there's anything wrong with that because you're not being told that in fact that's a terrible
Totally
thing to do,
inappropriate. Yeah.
and a terrible use of grafts as well, because there's always a limited amount of grafts to give in your lifetime. So you don't want to be using them all on a very, very low hairline.
Sure. Yeah, totally. So how many grafts can you actually use in a lifetime?
So it depends on the donor, the surface area and the density, but generally speaking, you can transplant perhaps 5,000, 6,000 follicles via the FUE
Okay.
technique. Strip surgery, you can, it depends on the laxity of the scalp, but you
see.
can definitely get a few more thousand that way.
Sure.
So it's quite a few,
Yeah.
but pretty much no one has enough donor to cover everything if it goes in its entirety, which is why the non-surgical side of hair restoration is so important.
Yeah. Okay, and in terms of recovery from the procedure, I know my recovery was totally straightforward, I have to say. There was a little bit of pain at the donor site. What is the normal process for that? How long would you kind of take to recover from the procedure and then eventually to see the final results? What?
So generally speaking, we say, first 5 days, you want to be at home looking after the grafts. They're very delicate and liable to damage, so really don't have too much on. Day 6, you can wear a loose-fitting hat or cap, so by that time, I usually tell people, if they want to do sort of video calls, things like that, should be fine. Redness and swelling should be down. And then really by 2 weeks, that's when you really can't change the outcome. So that's when you go back to sort of full gym, swimming, sauna, back to work. And a lot of people want to take 2 weeks off because they don't necessarily want to draw attention to it if they don't have to.
Yeah, okay. So Chris, in skincare and aesthetics and all of these things, there are a lot of treatments and kind of bogus things that people talk about and myths. Anything in the hair transplant world that's a kind of myth or snake oil that people are pushing?
Yeah, I mean, there's a lot.
Okay.
There's a lot. I mean, when it comes to looking for who to carry out your hair transplant surgery, there's really only sort of a few hard qualifications to look at. Diplomat status of the American board, member of the bars, member of the ISHRS, so that's what I'd be looking for. And really, it can be quite difficult for patients to know who is who. And when it comes to, the way clinics present themselves, I'd be a little bit skeptical of people, touting sort of 4th generation FUE, sapphire blade technology, and all this sort of, DHI, for example, as a separate technique. So, unfortunately, there's a lot of sort of buzzwords which are banded around to lure people in. And then when it comes to, vitamins, things like that, I mean, there's definitely no harm in it. But from a hair point of view, it depends if you're deficient or not. So over supplementation may not necessarily, be that advantageous. And especially when it comes to sort of the caffeine shampoos, I don't believe there's any evidence to show that they're particularly useful. So would certainly have a good look at those before sort of signing on for anything.
Are there any shampoos that you think, in terms of scalp health, anything that you would rate at all, or?
I think everyone has their own regimes. I mean, patients often ask me, how often should I wash my hair? Is it okay to just use shampoo or should I use conditioner? I think, everyone's skin is different and everyone's hair is different. As long as your scalp is clean and healthy, I tend to tell people, whatever works for you is absolutely fine. And similarly, when it comes to supplements and products, I've got many patients who tell me, I've started taking the supplement, my hair is much stronger and fuller, it's growing faster, and that's fantastic. There's no harm in that.
So, would you say there are any celebrities that you think have had really effective, good hair transplants at all?
Absolutely. Absolutely. I think it's become a lot more common, hair transplant surgery in general. I
Yeah.
think, perhaps 10, 15, 20 years ago, it was for only celebrities. But it's become a lot more accessible. The technology's, come a long way, and you get some really natural results. So I think there's a lot of celebrities out there who have had hair transplantation
Yeah.
that don't come forward, which is, fair
Sure.
enough.
Yeah.
And they're looking great. I mean, we've operated on our fair few,
Uh-huh.
and one of the reasons is that they say, well, it does affect my work,
Yeah.
and I want to look my best. And similarly for professionals in and around London, the most common reason that people want to get something is because I perform best if I feel my best, and hair transplantation can give a nice result with very few complications if performed correctly. And I think it's a great surgery.
Yeah, yeah. Amazing. And do you think generally men are talking about these things with other men more these days?
Yeah,
Than-
absolutely,
yeah.
absolutely. I mean, we often operate on somehow friends of friends of friends, and they say, well, no one said anything about it, and then I went for a hair transplant, and then my friends saw it and they thought, actually, no, it's not too bad,
Yeah.
not too bad at all. It does work.
Yeah.
And similarly with the finasteride and minoxidil, a lot of people still come to me and say, I think that doesn't work at all, and there's great evidence for it, and you can
Sure.
see clear differences. So yeah, it's definitely something which men talk about.
Yeah, yeah, yeah. I think that's just the same for skincare and aesthetic treatments. I do find that more and more men from all backgrounds are talking about these things with their friends.
Yeah.
So it's really interesting to see the change in the last couple of years. How about women that are approaching the perimenopause? That's quite a common group that maybe are experiencing changes in their skin in a way. How about with the hair? Is that something that you see much?
Absolutely. So similarly, around pregnancy, for example, around menopause, so any hormonal changes can, again, present with significant hair loss, and that can be understandably distressing. So from our point of view, the most important thing is to sort of medically optimize patients in general. And for our female patients, we most often refer to a dermatologist with a special interest in hair. They can do all the blood work, do all the hormonal screens, make sure they're optimized. And transplant surgery usually a bit further down the line, but can give good results. And also something that we're doing more now is SMPs, that's scalp micropigmentation. So especially for female patients, they often complain not only of loss of volume, but the fact that you can see scalp, and that's something which can be quite distressing. But SMP, which is essentially pigment, so you match the color of the pigment to the color of the hair, can quite nicely mask that scalp, and it's a non-invasive treatment, pretty much no downtime, and it's done over 2 or 3 sessions and can give very good results.
Yeah, amazing. And do you do that much for men as well? The SMP for any? Would it be somebody who's maybe not got enough donor grafts, or is there any particular cases that you
Yeah.
get more than others?
I mean, SMP, so I always think it's best in and amongst existing hair. So a few patients who have had a hair transplant say, look, it's great, but in certain lights, especially when I'm presenting or I'm on stage, I can just, still see scalp. And, one way to get around that is to use, products like Topic or fibers, which, just for those few hours where you have to not see scalp. But another option is SMP, and they want to go in and amongst the existing hair so you don't see anything at all. And the other way SMP is used, which can be very effective but has to be done absolutely perfectly, is the sort of shaved head look where, essentially it's giving a sort of shadow and the appearance of stubble.
Yeah.
It requires the patient to cut their hair very, very short, at least once every few days to maintain the look. But if it's done correctly, again, it can look very good.
Interesting. Yeah. And what about beard transplants? I saw somebody recently who had a beard transplant. It looked great, actually. What the process, I assume, is very similar. But where do you take hairs from for that?
Yeah, so beard transplant is something we do. It was very, very popular maybe 5 or 6 years ago.
Okay.
And yes, I'm starting to see a few more inquiries about it. But yes, the donor match, I mean, you can take grafts from underneath the chin. That gives the best match. So if it's a small area you want to cover, or perhaps a little defect, often there's maybe a scar or something like that. And then otherwise you can use hair from the back and sides as you would with hair transplant surgery. You can get some very nice results. Yeah. Very nice results. So similarly, eyebrow transplantation again is possible. Yeah. But those hairs always grow a bit longer, so you have to be aware of that before you go down that road.
Okay, interesting. Amazing. Great. Perfect. Thank you, Chris. So the final question is just basically a question that I'm asking all of their guests. If you're on a desert island and you could only take one skincare or hair care product, what would that be? And also, which treatment, I'm not sure if you do skin treatments or not, which treatment would you do if you could only do one for the rest of your life?
Well, in regards to hair treatment, I have to say, I've been taking oral finasteride for the last 9 years now.
Okay.
Yeah. My father was pretty much completely bald by the time he was early 30s.
Okay.
So I have to say, I think that's what's keeping the majority of my hair.
I see.
So that would be mine. And skincare, I have to say, the only skincare I do is oil of Olay.
Okay.
Every
this
day.
Is shameful, Chris. We're going to have to change that. Go, Chris. Thank you very much for coming on. So people can get in touch with you, just at your website, Instagram, and where you're located.
So www.thedesouzaclinic.com. We're located on 8 Upper Wimpole Street, and Instagram at the D'Souza Clinic.
Perfect. Thank you, Chris.
Lovely. Thank you.
Great. So, Chris, thanks so much for coming on. I think that people often think about the world of plastics and aesthetics and hair transplant as being quite a superficial world, but I know from my own experience that these things can really make quite a difference to people in their self-esteem and their view of themselves. So I think it's good for people to realise this, and I think that what you're doing is absolutely great, and I know that you're definitely one of the best. I'm delighted, and it really has changed my life having this done.
No, thank you. I'm glad to hear it. Very good. Thank you.
Thanks, Chris. So it was really interesting speaking to Chris today, because it's, as somebody who has had hair loss, and as I'm sure many of the people listening today are experiencing hair loss for whatever reason and are probably dosing up on vitamins, not really knowing what to do to solve this problem. And actually, Chris's very frank take on these things is really useful, because he cuts through the nonsense and says, this is what works, this is what not to do, this is what to do. And if you're that way inclined, then hair transplant is actually a relatively simple process. So really appreciate Chris coming on the show today, and we'll be hosting more experts like Chris in future. Other things that we're going to be covering on this show are things around skincare. I'll be joined by some entrepreneurs who have got skincare brands as well to hear about their entrepreneurial journeys. Lots of surgeons that I've worked with in the past and who I really rate, and other people who are in this field generally. So if you've got any requests and you have anybody that you feel that you would like to hear from, or any topics that you want me to cover, please do give me a shout, either on Instagram or emailing clinic@drdavidjack.com, and I'm going to curate a nice list of people who are real experts in their fields. So thank you again for listening. Don't forget to sign up to the podcast. Follow me on Instagram @DrDavidJack, and also on YouTube, which is Dr. David Jack.